Greetings once again. It's a pleasure to be back and it's a pleasure to be having this conversation with you. So, today, following the PSK conference, as I already promised, I'm going to do another video. And this is also looking at some of the reflections on what I learned and what observation that I made during the conference. So, for today, I'm going to look at the technicalities and the technical presentation that were being made. We had abstract presentation, keynote speeches, and every bit of it in terms of what practice entails, what research findings have we gathered over the years. But one of the key bits that I've noted, and as we're talking about developments in the pharmaceutical industry, we need to ask ourselves how sustainable are these interventions and these programs that we are putting into place. And if we're able to know about that, then we are already one step ahead to envision what the future would look like in the next 10, 20, or even 50 years from now. Because if we do not envision what that future would look like, we are going to kill the profession and we're going to kill the industry as it is, as we know it for now. So, how do we go about this? For me, the starting point is to ask ourselves what are the guiding frameworks for what we are doing at the current spaces of our work? Mostly, we have legislations, we have guidelines, and in Kenyan practice, we have the Pharmacy and Poisons Act Cap 244 that forms the basis of everything that we're doing. But at the same time, we have to be cognizant of the fact that because of different legislative processes, legislative approaches, and interventions, we've had different changes and different proposed amendments to this Act of Parliament. These amendments, actually, to the greatest extent that I can remember in terms of the time that I started engaging with them, was from 2018. We had the Health Amendments Act, which touched on the same bill, Cap 244. We had the same amendments coming again, multiple with different variations in 2019, 2020, 2022, 2023. Now we are still having conversation about a Health Amendment Act. We have the KFDA bill that was proposed in 2019, had discussions on different fronts, got recalled, got reviewed again, and there's still conversation that it might be coming back in some form or the other with different variations to it. The question is, are these bills, are these regulations, are these frameworks going to ensure that we open the space for practice for ourselves as professionals, but also in service of the general public? Is it going to ensure that Wanjiku has access to the right quality medicines that they need to be able to attain positive health outcomes? Maybe not. And if that is the case, then we need to ask ourselves, how do we ensure that Wanjiku is protected and catered for, but at the same time practice for David, who is a pharmacist, who wants to be able to practice as its optimum, is able to do that? And as much as David is doing that, he's able to do it in a sustainable way because there are innovative business models that are ensuring that there is a financing mechanism for whatever service that he's offering or the paying for his salary, with if whether employed or not employed. And we have to ensure that that is anchored on an enabling pharmaceutical ecosystem. And that ecosystem is entailed of practitioners, the professionals, the stakeholders who include the employers, the business community, and the enterprises that are running, the government entities and agencies that are either regulating the regulatory body, or the government agencies and institutions that are employing and offering medical services, that is including the hospital that we're talking about medical supply agencies like KEMSA, and all these institutions have a role to play, and even the technical working groups within the Ministry of Health have to be actively and robustly engaged. It is going to be paramount and imperative for us to ask ourselves how that future looks like. So when you understand all those dynamics and also the legislative and the policy aspect, you ask yourself, what is the correlation to the conference that we are having, that we had presentations on? As pharmacists, there is an opportunity for us to be able to be actively involved and engaged in shaping the trajectory of what policies we envision and what policies we want to happen. Policies are not made in isolation. They're not made in vacuums. They are informed by practice. They're informed by research. We had a lot of abstract presentations. When I looked at the average, we had more than 40 or 50 thereabout of abstracts that were submitted, some published in the booklet, some were presented during the live sessions. Out of all these 50, very limited number of them were looking at what would be the policy implication in transforming this to practice. I would give an example of one of them that was talking about access to pre-exposure prophylaxis medications in the community pharmacy level. That would be a robust and actually an innovative approach because we understand the risks that people are involved in, and therefore there's need for them to be able to get these medications as early as possible. And also when we look at it, that is the post-exposure prophylaxis and the pre-exposure prophylaxis. There's access and the convenience of pharmacies next to the neighborhoods. Therefore, people would be more secure in their use and in their sexual activity as well. So that would be a good thing. But the question you ask yourself from evidence and from what kind of intervention has been done in some of these clinic hospitals and the community pharmacies from the different grant funded projects and proposals and research, what is the translation to policy? Do we have a recommendation that actually, beyond that initial level of landscape analysis and case project, how do we translate the research findings that this is an ideal avenue and mechanism to which we can offer care to the communities into being a policy imperative? And then if it's going to be a policy direction and a policy paper that is going to be developed, how do we ensure that this opens up the scope of practice, but opening up the scope of practice in ensuring that there's access to better quality services on one end? Those are key. So when you looked at the abstracts, both scientific and the operational, translational research and all that, then there was limited correlation from research to practice, and from research to practice, then from practice to policy. Because if with these interventions and these research findings that we're having do not get an anchor in policy, they do not get an anchor in any legislative framework, there is no guarantee that as my son in the next 10-20 years getting into the pharmacy place would be able to practice the same, unless somebody ensures that it is ingrained into policy. The only way that will happen is the person who have done the research and have actually identified this as a possible avenue to be able to practice and apply that knowledge. Or the person who has researched on it and generated the findings is able to push for it and actually look at what are the policy the information dissemination mechanism and pathway that will ensure that this insight that we're gaining from research from the scientific conference is now going to be translated into policy. That is going to be very paramount for us. When you're talking about evidence and experiences that we're having in our own different domains of practice, let's say, for example, I work as a regulatory affairs pharmacist. What are the challenges? What are the gaps? What are the nuances around that industry that need to be changed? How will they be changed? Who needs to change them? It is upon me, an imperative of me, to be able to craft those abstracts and articles and share my experiences and best practices, also pointing out the flaws and the shortfalls. Then from these, I'm mandated and actually expected to engage with the regulatory agency, that is Pharmacy and Poisons Board, and share this perspective for them to improve in terms of the guidelines and the guidance document that they have and the policy documents as well, to be able to ensure we advance in practice and opening up the space for us as practicing professionals in the regulatory affairs space. But at the same time, the ball is on us as pharmacists within the professional network. We need to ask ourselves, after we come to the conference, if at all we'll now improve from what we're discussing, what I'm sharing in this particular moment, your research will have a policy component to it. It's not only research that is generating insight, that the insight does never get to see the light of day, it never gets to be used in any other case. It needs to have functionality and applicability of that knowledge and those insights. So that is key. Once you've understood the applicability, the sustainable component would come in, having these insights informing policies and informing policy documents that are going to be generated. So that policy perspective has to be integrated, one, in practice, two, in research, and two, in our conference and discussion forums where we engage in. Those need to be key, and that needs to be paramount in all that we do. The next bit that we need to ask ourselves when we get to these scientific conferences and we have these presentations, these discussions and everything, how do we ensure that the resolution from this kind of engagements get to see the light of day? What are the key outcomes? How do we ensure that these outcomes are followed on? That is where the work that I'll do as a professional in presenting an abstract will form a kind of, I would say, white paper that the Pharmaceutical Society of Kenya, the professional association, the platform that we all subscribe to and all are members of, are able now to use that finding and consolidate it in coming up with a white paper. That white paper should form an advocacy tool in pushing for policy, legislative, and industry transformative strategic plans and blueprints. Because if we don't have a blueprint, we are never going to achieve the successes that we hope for. And therefore, we need to start from that perspective. So as a personal initiative, as a personal level, I need to ask myself, for whatever I'm practicing, how does it contribute to policy reforms? How does it contribute to policy dynamics and nuances? Does it translate into practice and best trends that need to be adopted in the market? Then once I'm done with that transformation, I need to ask myself, when I go to the scientific conference and I'm sharing these, are we mandating and actually holding our leaders accountable to ensure that some of the nuances and challenges and also the new insight that we're gathering are going to be collated as white papers to be used in policy advocacy resources? And that is where now the data generation, knowledge management, and most institutions have knowledge management resources and knowledge management solutions that they're offering. How do we do that? And that is one of the key things that we're trying to emphasize, and also trying to institutionalize within the work we do within African Pharmaceutical Network, to ensure that we have a knowledge repository. And that knowledge repository is not somewhere you just get information and leave it there. It's a living knowledge repository where we have information, we have resources, but that resource is able to be applied in terms of informing practice, developing new innovative models of care delivering, but also new business ventures. And in that way, there is the sustainability from the economic imperative of it, but also there's a sustainability from a political policy perspective, because these practices are informing that. And the most critical bit, and actually the most fascinating for me, is the fact that it would have the socio dynamic aspect in terms of development. I am able to guarantee that the services that I got today, the services that my mother got in the local village where he is in Siaya County, is translatable in the sense that another patient in Garissa County, another patient in Mandera would be able to get the right quality, the same quality of care and service, including medicines and medical products, in that location, because we institutionalize and ensure that these best practices are not isolated, are not left in silos in the particular locations where either the research happened or the professional who was unique in his own predisposition to do the work in that locality did it. It is becoming a norm and a standard across industry. And if all of us are able to practice within those standards because they are institutionalized, they are made accessible, then that would be a win. And the last bit, we need to ensure that these insights and these new perspectives and these new knowledge streams, it's going to be made accessible to our members. And the membership has to have access to it. I had a conversation during the same conference, and we told we have an MTM policy and guidance document that is in place. How many of us as pharmacists have access to that document? How will you practice if you do not have access to a guiding document that should be able to inform how you offer care, how you practice, and how you course correct? And also an opportunity for you to ask yourself, is it practical in your local domain and local area of practice? If not, how do you inform it to ensure that that growth is happening? Those are conversations that we need to be having. And we need to be having it from a point of sustaining and upholding the privilege and the professionalism of our society, but at the same time opening up other avenues to ensure that we mainstream quality, optimal care to the patients who are counting on us and believe in our capability to serve them. If you enjoy the conversation and feel interested to engage more, please share the comments that you have with me on the chat, on the comment section, so that I'm able to respond where I need to, and also share any other topics that you feel we need to have a conversation on. If you enjoy, engage, please subscribe to the channel. Let's keep growing, and I'm grateful for the 573 who have already subscribed. To the 10,000 views that we have, it is because of you that we're able to learn and grow the profession. And when growing profession, we're not only growing it as a profession, but growing it as a profession of service to humanity and service to the population that we serve. Thank you, and let's engage next Sunday.